I'm going to begin by doing the anterior jaw test. And I'm going to begin by placing my one hand on the calcaneus and one on the anterior portion of the lower leg. I'm going to be doing an anterior translation to test for increased movement and increased laxity of the ATF valve. If there is increased movement and increased laxity, this is a positive test. The next test I'm going to be doing is the Lockman's test. I'm going to begin by placing the patient's knee at a 20-degree angle. I'm going to place my one hand on the back portion of the leg, the posterior portion, and my thumb on the tibial trochanter, and my other hand on the one side of the femur. I'm going to be doing an anterior translation to test for increased movement and increased laxity of the ACL. If there is increased movement and increased laxity, this is a positive test. The third test I'm going to be doing is the Neer's test. I'm going to place my one hand on the scapula to stabilize, and I'm going to passively move the patient's arm, flex the arm, as well as internally rotate, and it is a positive test. This is testing shoulder impingement, and this is a positive test if there is pain or the patient tries to resist the movement.